Sir, how are you?
Doing well. How are you, buddy?
Good. Okay. So what we're going to do is we're going to demonstrate an exam today, and I want to demonstrate what my exams look like. My exams that I do in the exam room for vaccines, in the exam room when they're sick, before surgery, and all of our exams are exactly the same. I want that way every time we do an exam, we don't miss anything because it's repetition. It's exactly the same on every single pet. So this is going to be an exam on a dog. Cat exams are a little bit different, but for the most part, most pets exams are very, very similar. So tip of the nose to tip of the tail is what I always say when I'm doing my examinations. We want to start here and we want to end back here. So basically what we do, this is Splash. Splash is a miniature schnauzer. Yep, he's a good boy. I've seen Splash many times. So what we're going to do is I'm going to show you how we do. So the first thing I do when I'm doing my exams is I look at the head. I always look at the face, and I try to get him to look at me so I can kind of see basically what does the owner see when the dog is looking at the owner. All right, so I always want to look at the eyes, just the general mentation, the structure of the face, and just how everything looks. Okay, sometimes when we're talking to Splash, if you say their name, they'll pop their ears up like they do when they're at home. A lot of times here they're so nervous, you can see Splash is a little nervous, and they get their ears back. So first and foremost, I always want to look at the teeth. Okay, so when we're looking at teeth, you want to see the tartar buildup, and I always tell owners, don't just do this when you're looking at teeth, because you're only seeing 4 or 5 teeth in the mouth. Okay, you're not seeing the whole entire arcade, and this is where tartar tends to build up more quickly. Okay, is back in the back. So it's easy to lift the lip, pull it back so that we can see it. Okay, and you can see there's a little bit of tartar here. Now previously we talked about, hold still Splash, it's okay, Bob, we talked about the different grades of teeth. Okay, and the grading system on how much tartar and gingivitis and so on and so forth that's there. That would be, I would call this a grade 2 mouth. Tartar buildup but minimal gum disease. Okay, now the other thing, excuse me, I always look at the eyes. Okay, so I'm going to turn the lights off so he can dilate a little bit. What's the buddy? Good boy. Now in this part of the exam, we're not just looking at the eyes like the owners would see it, because owners can't see this. I'm looking at the retina, which is in the very, very back of the eye. I have to look through the lens into the retina. And we can also see the optic disc and all the blood vessels that go in the back of the eye. Okay? And we want to do this obviously on both eyes, because not all eyes are always the same. Look at me, Splash. Good boy. Good boy. It's all right, Bubba. You're being a good boy. Yes, you are. You're being a good boy. Good. Also then, oftentimes I will back off so that I can look at the cornea a little better and the lens a little better. Good boy. So Splash's eyes look fine. Then I do like to look in the ears as well. Hold on, baby. Hold on, baby. So what I'm doing is I'm looking in the canal. The dog ear has 2 canals, a vertical canal and a horizontal canal. And we want to look in both canals all the way down to the eardrum. Beautiful. Good boy. Good boy. All right. A lot of times also what owners will see me do is I will grab a hold of the dog's head like this, and what I'm palpating here is the lymph nodes that are at the curve of the jaw here. Okay? And then a lot of times I slide down and I feel on both sides here because there are lymph nodes right here as well. I tend to then slide around and I start looking at the feet. Now, because dogs with allergies do have a tendency to want to lick their feet a lot, I always lift the foot and part the pads so that we can kind of see what's in between the pads. Okay? And you also can tell if they're looking on the top of the foot as well. Foot, good boy. Okay? So all of this looks good. And they have 4 feet, so we have to look at all 4. Good. Now, the other thing that I like to do is we palpate the abdomen. So a lot of times what we're feeling for here is I'm pushing, and my palpation is a pretty firm palpation. So I try to feel anything in the intestine or the urinary bladder or anything that would be abnormal in the abdomen. Splash feels fine. He's probably thinking, what is going on? Good, good boy. Now, I also, as you can see, I face the dog away from me. I also like to look at the top line here. We look at the shape of the dog. Do we still have a waist? If we don't have a waist, that means our dog is probably a little bit overweight. Or if we have really bony prominences sticking out, maybe a little bit underweight. Okay. Now, the other thing that I like to do is I always try to check their hips. And this is called range of motion, when you just come up and you do range of motion like this. And I'm listening for cracking and popping, as well as any discomfort that he might have in the event that I manipulate. And if his hip is bad and we manipulate and I pull back like this might be painful, and he would of course react to that. Also in the back leg, it's very common, especially for the smaller breeds, to have a kneecap that may pop off. And Splash's kneecap moves a little bit, but it stays where it's supposed to be, so that's good. Some of these dogs will have kneecaps that actually pop off, and that's good. Awesome. Now, it is important to look underneath the tail, make sure there's not any tumors or anything around the rear end. And in this case, Splash is neutered, so we don't have anything underneath in the genitalia area to feel as well. And we always feel underneath. And again, one of the biggest things is lumps and bumps. So the more we put our hands on these guys, the more we're apt to feel lumps and bumps. And I will a lot of times ask an owner, are there any lumps and bumps that you have felt that I have missed? Just to be sure that the owner doesn't say, oh, I forgot to tell you there's a lump underneath his collar or something like that. Okay. The other thing I like to do is I do like to pet the hair backwards on the top line. This lets me look at the skin a little bit easier. Now, Splash's hair is very short. You get into other breeds, and there's a lot more hair to deal with. But mainly what I'm looking for here, making sure that we don't have any external parasites, fleas and ticks and that kind of stuff. And then finally, I always listen to the heart and lungs. Now, I typically will use the smaller side for the heart and the larger side for the lungs. Good boy, good boy. Good, and everything sounds fine with Splash. So that it will be our typical wellness exam that we do. Of course, if there is a problem, if this is not a wellness exam, if this dog was limping or owner had a specific concern, then sometimes we go from there. We might manipulate the leg a little bit more. We might palpate down the back, trying to feel, hey, is there any spinal pain or anything like that? That would be different than what we would normally look for in just a regular examination. So Splash's exam is fine. Everything looks good, feels good. He's just wanting to be done.
Yeah.
All right, perfect. So I'm going to give him his shot, and you'll be able to go home, Splasher. I usually recommend a good, thorough physical exam at least once a year on a young pet, and then as they do become into senior pets, or we do have some potential ongoing problems, we would do that twice a year as well. And then of course, anytime they're ill, they get an exam. So Splash could use a dentistry.
Yeah.
His exam is pretty normal on everything else. I didn't find any lumps or bumps. Heart sounds fine, and that's the one thing that people will notice with my exams is I listen to the heart and lungs for a long time, because heart can do irregular beats that are not real quick and easy. Sometimes we can't ask them to hold their breath like they do us, so I just listen to them breathe over and over and over. Everything sounds fine with his. His eyes are good, his ears are good. Only complaint I've got is his teeth.
Have you been recommended teeth cleaning?
I do recommend a dental on him. We do dentistry, you know, under anesthesia, and yeah, we do that. Splash is what age? 3 years old. So I do ask for fluids, you know, when they go to sleep. Preoperative blood work will be more an option for you because he's a younger guy. But we get him asleep. I place an IV catheter. We get him asleep. We clean. I X-ray everything in the mouth, and then if there's any problems, I call you when we're doing it. So I do ask when they're asleep that you have your phone handy, but I've got your cell phone. So we would just go from there, get everything cleaned up, and then when you come to take him home, I'll show you the X-rays and everything. Alrighty. All right, Splash, you did it. See, now you're not so worried. He says, "'Cause I'm done. I'm finished."
Yeah.
All right. Any problems with the shot? It's on the left shoulder, lumps, bumps, soreness, anything like that, let me know. I don't anticipate it, but he's had that shot before, so.
Yeah. Then they also give him this pill. Is there a pill?
There's a pill here going home for you. Yeah, you just give that to him. It's a chewable.
Okay.
So that will control his fleas and ticks then for about 3 more months.
Cool. So that's every 3 months.
It's every 3
I
months.
was confused. I thought that was every 6.
It's every 3 months. A shot's every 6. I send you a reminder for both.
That's what. Okay. And that's what I have. Yeah.
So yeah, you'll get the reminder for that. For the Brevecto, I don't need to see him for that. You just come in and get it, or I can drop it by the store, whatever. And you'll get a reminder in 6 months for his next Pro Heart injection.
Cool.